Hello, my name is May Kwong. I'm the Executive Director at the Center for Connected Health Policy. Today, we'll be talking about the Connect Act for Health. A few disclaimers before we get started. Please know that any information provided in today's talk is not to be considered legal advice. It is strictly for informational purposes. CCHP always recommends that if you are interested in a formal legal opinion, to please consult with legal counsel. Also, know if I happen to mention a company or show some type of product, know that neither I nor CCHP has any type of relevant financial interest, relationship arrangement, or affiliation with such a company. A bit of background about CCHP. We were established as a California telehealth policy organization in 2009 as a program underneath the Public Health Institute, but an opportunity to become the federally designated National Telehealth Policy Resource Center became available in 2012 through a grant from HRSA. CCHP applied for that, we received it, and we've been serving in that capacity ever since. We also work with a variety of other funders and partners on the state and federal level on more specific projects related to connected health or telehealth. We also act as the administrator for the National Consortium of Telehealth Resource Centers, which are the 14 telehealth resource centers who are underneath the same grant program as CCHP. There are 12 regional resource centers that cover specific states and 2 national centers, one on technology and one on policy, which is CCHP. We are also the convener for the California Telehealth Policy Coalition, which is made up of over 100 statewide and national groups who are interested in California telehealth policy. As most of you know, there were significant changes made, but on a temporary basis, both on the federal and state level in response to COVID-19 in the area of telehealth policy. The question now remains on both levels, both on the state and federal level, is what happens next? Are any of these changes going to be made permanent? And so far, there have been some changes on the state level that have been made permanent and some that are still pending. And the question mark remains, will they remain in a permanent state or a temporary state, or will they disappear altogether, especially with many states declaring their state health emergencies over and opening up? On the federal level, there have been pieces of legislation that have been introduced to try to maintain the temporary waivers on a permanent basis. One of the biggest ones is the one we'll be talking about today, which is the Connect Act. So for those of you who might be familiar with this, there's been many iterations of this particular bill. Its author is Senator Brian Schatz from Hawaii, and the new bill number for it this year is S1512. What it will do is remove some of the barriers to telehealth coverage on the federal level in the Medicare program. Now, a lot of you may remember that the Medicare limitations, a lot of them are in federal statutes. So it would require a federal bill for those changes to be made permanent or for those barriers to be removed completely. So what does the Connect Act do? A couple of things. So it will allow the home to be an eligible site for all services. It will also remove the geographic limitations. So immediately the big impact would be removing those site limitations on where the patient's located. It would also add FQHCs and RHCs to the list of eligible providers. Now remember, even though we're in this temporary state with COVID-19 and FQHCs and RHCs are allowed to provide services via telehealth underneath the Medicare program, that's a temporary measure right there. So the permanent telehealth policies do not allow federally qualified health centers or rural health clinics to act as distance site providers. This bill would change this, and it would also allow them to receive their PPS or AIR rate, which is the regular rate they would receive for a visit. It also says that geographic limitations would not apply to Indian health services facilities or if somebody was providing emergency care. And also, no facility fees would be made for some of these new exceptions, like, for example, the home. Other things that the act does, it actually gives a lot of power to the Secretary of Health and Human Services. So it gives the Secretary the ability to remove certain barriers without having to go back to Congress. So what the Secretary could do was remove barriers on originating site, geographic limitations, limitations on the technologies used, limitations on the practitioners who can use telehealth and be reimbursed, and the types of services covered, and any other type of limitation that the Secretary thought was necessary. The Secretary would also be able to set policies and fee schedules for these waivers. Now, what this all means is that, again, the Secretary would not have to go back to Congress in order to make some of these changes. So, for example, I said FQHCs and RHCs are allowed to be distance site providers. Underneath the Connect Act, they were the only new sort of providers added to the eligible provider list. Still off the list were PTs and OTs. If this bill passes and this section is still intact, the secretary would have the power to say, we're going to add physical therapists and occupational therapists to this list of eligible providers. And the secretary does not need to go back to Congress and wait for them to pass a bill. The secretary would be able to do that on their own. However, the secretary would be able to set policies and fee schedules for those waivers that he or she makes. So, for example, our PT and OT example, secretary puts them on the eligible provider list, but then the secretary says, but you know what? They can only provide the services for people who are located in the home, and they will only get paid $50 for each service provided via telehealth. So the secretary would be able to set these other policies, particularly specifically for the waivers that were instituted by that secretary. And also keep in mind that these are administrative moves that the secretary could do. So if you have like a change in secretary, you may have a secretary, a new one that comes in that rolls back the previous secretary's policies. So it's unlike, something that's in federal statute. It's not something that would be difficult to roll back, especially if you have like a new secretary, or perhaps even the secretary that made the waiver decides to roll it back about a month later or a year later. Other things that the Connect Act would do, there's a section on there about program integrity. So a lot of questions that have been floating around as people debate whether to keep some of these temporary policies around and make them permanent has been, what about fraud? Is there a lot of fraud going on? How do we check that? How do we make sure it doesn't happen? The Connect Act provides some funding to ensure more program integrity. And basically what it does is it provides the Inspector General and HHS $3 million to conduct investigations and other duties which were not specified to ensure program integrity. It also, keeping in mind that it's not fraud. Sometimes maybe, providers just didn't know what type of policy was in place and they accidentally built something wrong. So there is also a requirement that secretary make training and education resources available to providers and beneficiaries so they know what changes happen, which is a really good thing, I think, to see happen. It's more about keeping the beneficiaries and providers informed on what the policies are and making sure that they're up to date so they don't inadvertently make mistakes. The other section of the bill talks about data and testing models. So it will charge the secretary with collecting and analyzing data for both telehealth and communications technology-based services. So remember, your CTBS are those virtual check-ins. It's also where the chronic care management codes are under. So it's all of those codes as well. And what the data they'll be looking at is utilization rate, the quality health outcomes, and they specifically said audio only. A report will be issued to Congress, and also there will be analysis of telehealth waivers and alternative payment models. If you would like more information about the Connect Act, you can go to CCHP. We do have a fact sheet on it available. That is the URL link to it. It is one of the more comprehensive bills out there on the federal level related to the temporary changes and trying to make them permanent. For those of you who have been around for a while, you know that Senator Schatz has been a great proponent for telehealth. So he has introduced this bill several times over the years, and it's been adjusted for like the needs of the current environment. So he's done that once again with this particular version. If you are interested in more news from CCHP, you can subscribe to our newsletter, or you can visit our website for more information, such as our 50-state report and other fact sheets that we may have available. But other than that, I thank you and hope to see you again.